This health innovation-themed episode of Advancing Healthcare Through Simulation is brought to you by Amedico and Health Everywhere Hub. Welcome to Advancing Healthcare Through Simulation, the podcast where we explore the innovations, partnerships, and ideas shaping the future of healthcare education and practice. Through conversations with leaders from across healthcare, research, and patient advocacy, we uncover how collaboration and innovation can help build safer, more connected, and more person-centered systems. Today's episode focuses on the topic that affects every aspect of healthcare delivery, health data interoperability, and the power of connected information. How do we ensure that health information follows patients wherever they receive care? What barriers stand in the way of a truly integrated healthcare system? And how can researchers, clinicians, policymakers, and patients work together to create a system that is safer, smarter, and more responsive? Joining me are two remarkable leaders whose perspectives from health informatics and patient advocacy highlight why interoperability is not simply a technology issue, but a human one. Dr. Tyler Williamson is the director of the Center for Health Informatics and a professor in biostatistics in the Department of Community Health Sciences at the University of Calgary. He is a member of the O'Brien Institute for Public Health, the Alberta Children's Hospital Research Institute, and the Leiden Cardiovascular Institute. His research focuses on the use of electronic medical record data and chronic disease surveillance, health services research, and quality improvement, including the integration of EMR and health administrative data. He is nationally and internationally recognized in his field, and through his work with Networked Health since 2023, he has contributed to revisions of Alberta's Health Information Act and federal health data legislation. Joining him is Teri Price, Executive Director of Greg's Wings Projects, a nonprofit organization established in honor of her brother Greg Price. Driven by the impact of Greg's experience, Teri and her family are committed to improving healthcare. The organization's first major project was the production of the film Falling Through the Cracks, Greg's Story, which Teri has shared the film and facilitated post-film discussions over 800 times. Teri is a co-chair of Networked Health Alberta and a board member for the Patient Revolution. She has also contributed to numerous provincial and federal committees focused on health information, digital health, health human resources, cancer diagnoses, and healthcare strategy. Together, Tyler and Teri have helped shape important conversation about Canada's health data future, bringing together the perspectives of research, policy, and lived experience. Tyler and Teri, welcome to Advancing Healthcare Through Simulation. Well, Tyler and Teri, welcome to the podcast. We're so excited to have you both join us today.
Thank you.
Thanks for the invitation.
And for listeners who may not be familiar with some of your work or even some of the terms, I thought we'd start out with a definition of health data interoperability and why should healthcare providers, patients, and educators be familiar with it and care about it?
I think there's a perception that our health data are far more connected than they actually are. That's the real issue, is that our health data are not well connected to each other. Information that happens in primary care isn't always connected into the hospital systems, or even within particular systems. There's information loss, and there's information that doesn't flow, and ultimately healthcare is almost always entirely about health information. It's about using all the information you've got, whether that's diagnostics or other things, to try and make a decision on how to help this person right in front of you. And I'm honored always to be able to speak with Teri, but Teri's family experience is a perfect manifestation of what happens when our health system isn't well connected, our health information isn't well connected, is that there's real harm that's done to people when we are asked to act in ways without full information.
So, especially important for patients and families to know the limitations and advocate on behalf, would you say, Teri?
Yeah, for sure. I think that is like, I completely agree with Tyler that a lot of people make assumptions about where their information is available if it follows them through the system. That's sort of how I think of the definition of interoperability. Like in an ideal world, if we had a fully interoperable health data systems, the information would follow the patient through the system, and the patient's care team would have access to the information they need so that they can partner and make effective decisions and work together as a team. For Greg's case, his information sat in different parts of the system, and when he interacted with different parts of the system, they were making decisions based on a slice of the information. And we're confident that, especially, he sort of had some symptoms that were flagged in primary care around a thickening of the epididymis, and then had back pain. That information was in completely different parts of the system that wasn't accessible to the different members of the health workforce Greg was seeking care from. And we fully believe that, especially those two pieces of information, if they were in the same place, the connection to testicular cancer would have been made a lot sooner, which can make a huge difference for patients. And so it's stressful for the health workforce, and we know it's resulting in patient harm. And so it's one of the reasons why we really are pushing and advocating for improvement in that space, whatever term we want to use to define it. But it's really about that information following the patient and being available to the care team.
Yeah. And can I pick up on that some more, Terry? Like, the example, because it relates to all of us, is usually about individual patient care, right? And Greg's example is a sad example of when it doesn't work well. But there's other really bad things that can happen too. And like, you know, there's the element of poor care, but there's also like, damage to the individuals. Terry alluded to this, like damage to the workforce. Like, let me tell you, it's a lousy feeling if you're trying to do your best and you make a decision and then find out later that you didn't have all the information. That damages our health workforce. That's not something that we want to be doing. It also means that we're running a system that may not be as efficient as it could possibly be, right? When we don't measure how the whole system works because the information is all disconnected, then we can't optimize that system. And we spend a lot of money on our health system, and so 1% and 2% gains can make a massive difference. And we can study how investments in primary care mean things over here, but without the connected information, it's not really a system unless it's all connected. It's just, we call it a system, but without that, would you call a company if they had like different pieces of work, but they didn't ever connect to each other? No, you wouldn't. And so it's not functioning as a system right now.
And I think setting up our future healthcare providers with the information they need about the system, how it is, how we can improve it, being a part of those opportunities to improvement is a piece of that education that's critical as well.
For sure.
So I think you've done a great job of kind of speaking to this already, but I'll ask you to elaborate maybe. The title of the publication that you collaborated on is Human Factor Health Data Interoperability, and it really emphasizes the human factor. So what are the biggest cultural or relational barriers preventing healthcare organizations from sharing and using data effectively?
It's a great question. It's been a fascinating journey for us over these last few years as we've really dug into this issue of, why isn't our health data connected, right? We just described that it isn't, and then the question that we've been asking is, why is that the case? Maybe it's this, or maybe it's another thing, and so we've gone all the way through all of the different pieces of legislation that define our health system, from the Canada Health Act to the Health Information Acts in provinces, and up and down and everything. And And when you talk to some people, they'll say that the Health Information Acts are permissive of better health information sharing and all of these kinds of things. And I want to make it also crystal clear that in all of our work, um, we have not been able to find a person that's responsible for the dysfunction. I can't be like, Lisa, this is your fault. You're doing a bad job. And therefore, if we just replaced you, we'd be good to go. That doesn't exist. And so I want to make it clear that, like, while I think that we've got some challenges, it's not one person's problem to solve. It's not the government's problem to solve. It's not healthcare providers. It's not, it's a collective problem that needs to be solved. So um, the the real challenge though is that we've created a culture where sharing of information and not doing that well is penalized. So if I use health information inappropriately, there are real penalties for that, and that's important. Don't get me wrong, but we haven't in any way um, disincentivized the hoarding of information and keeping of information and not using it for the benefit of the patient. Right? There's no consequence for me just like collecting or keeping personal information if I'm a particular health organization and never sharing it. And when we've penalized the accidental disclosure, we've incentivized people to just keep it protected and never to use it. That's one of the challenges. And this is all just coming from our decisions as a society around how we're going to use this health information. And so it's really a people problem, not a technical problem. We could make the data connect tomorrow if people would agree that we wanted that to happen, that we wanted these data to be connected. And so that's why we've referred to it as human factor interoperability, because it's a people problem, not a technical problem.
I mean, even the language, like interoperability, like it does sort of, it's the people that know that term and use that term or more in that technical kind of background and understanding and have been working towards trying to create the system that is interoperable for years and years and years. And so again, to sort of go back to Tyler's why hasn't this happened? And it's more the people, the human factor of it that is the culture and reinforcement of some ideas or understanding or focusing more like privacy and security. As an example, we fully believe we need private and secure health information. But historically, there's been a lot more conversation about keeping information private and secure than there has been about how critically important it is to be able to share with the members of the patient's care team. And so there's some of that sort of mindset and culture that is part of it. There's also just sort of the policy. So that's definitely fits within the culture and mindset part of it. And all of these are so interrelated, but the policies, the legislation that sort of helps or contributes to the culture and the mindsets also doesn't necessarily enable the kind of system that we want to have, and that sharing of information and enabling the information to easily follow the patient through the system. In the cases where is happening, it's people like stepping up and sometimes feeling like they're going above and beyond instead of it being the easy thing or the default or the safe way of doing it, which there's mindsets that can help with that is required and to enable that, but there's some of the policy and legislation and some of those other system design that's not only technical around incentives and all of that kind of stuff that can also contribute to the people in the system being able to enable the human factor of interoperability as well.
Yeah, great point. One thing that Teri said reminded me of something that we say to each other in our work is You know, we don't collect health information for the purpose of protecting it. Like sometimes I think that we do, right? Like we're so cautious about the use of health information. And don't get me wrong, I don't want my health information or anybody's health information be ending in the wrong place, but I definitely want it to go to the right place. And I think that we think that we're like, nope, we're just going to protect this. And the truth is, we need to use it. We need to use it for the care of the person there, and for the optimization of the system, and for learning, and for innovation, and on and on and on. That's what we need to use it for.
Yeah, this kind of brings me to another thought where around training healthcare providers in silos, and kind of supports that siloed work, and maybe if there is a bit more of that interprofessional education happening consistently throughout, do you think it would have, a positive impact maybe on the sharing of these things that you're mentioning?
And you probably can anticipate what I'm going to say, because we're grateful that we get to share our film with you every year, at least once a year, Lisa, and we really do believe that interprofessional education is really critical. It can, I would hope, it shifts that mindset around recognizing that doing things in silos, or sort of protecting professional boundaries at the consequence of the potential for collaboration and true teamwork, is not what we want to see in the future of healthcare. If we want safe care and we want sort of the careful and kind care in the system, we have to have the workforce and patients and families, but everybody in healthcare recognizing how critically important it is to be able to work together. And you can't effectively work together if you can't communicate and share information. So to me, those things are all very closely connected and really critical for both the future generations to understand. But we also need to be having these conversations within the system, because it's I always worry a little bit about shocking the people that we're training when they hit the reality of how the current system is functioning, and making sure they're prepared to speak up and be part of the change that we need to see, and see that that some of the changes that we need to see, like the technical factors of it, are possible. So speaking up and supporting change in a clinic or in some part of the healthcare system that enables the sharing of information and enables teamwork and safe care, I hope that people recognize their role in that. But it does start with educating that way in the beginning.
Tyler kind of alluded to this earlier, that many healthcare organizations have invested heavily in digital technologies, yet clinicians and patients still experience fragmented care. Where do you see the disconnect between technology implementation and meaningful system integration?
Thanks, Lisa. This is an age-old problem of like, um, you know, men when they're about my age have historically gone and bought a sports car thinking that that's going to solve any dissatisfaction. It's the same type of idea of like like feeling powerless to solve a problem, and then hoping that buying some technology is going to fix the problem. And I think that's what's really been so wonderful about our work with networked health, and our partnership with Health Everywhere, is studying what the problem is, not just like, you know being like, oh man, if only we had Connect Care, right? Like, there are really positive things that come from buying valuable technologies. Um, but when you don't fix the underlying problem, which is like bad, or inadequate, that's not maybe not the right word, but inadequate health data design, you don't get to the solution that you want. And as we describe, I think, well in our report, there are human factors that must be addressed, and you can't solve human factors with a technical solution. It's not a technical problem actually that we're trying to solve. As I said earlier, if you told me tomorrow that I had the mandate to connect this health information, I could start working on it tomorrow, right? Like we could solve this problem. Our in other parts of our digital lives, our information is connected, but because of the way that we've chosen to set up our health data, it doesn't connect, and it's not a technical problem; it's a human problem.
Yeah, there's sort of two things that I always refer to in my mind when we get questions like this. One is, I think it's an Einstein quote around taking 55 minutes to understand the problem and 5 minutes to solve it. And I think it goes to that systemic lens, the part of the conversations that's focusing on that systemic lens. If we're deploying technology in one piece and expecting it to solve the issues that the whole system faces, it's not going to work. I think there is a huge amount of value and opportunity in understanding the system from a systems lens, whereas it tends to be that we'll look for sort of the low-hanging fruit, the thing that we can do to prove that we're doing something, instead of doing some of the hard work that is actually understanding deeply what is happening in the system and how we can work together to address some of those issues. And the other thing that has been sticky for me is this approach around thinking about dissolving problems versus solving problems. So thinking upstream about what caused the problems in the first place, not just reacting to a problem sort of in the moment. And we see a lot of people doing great work in solving problems, and sometimes it's like extra workarounds. The fax machine comes up in conversations quite often after the film, and there's so much work that's done and so much effort and time spent to sort of work around trying to make sure that you can still have safe care with the existence of the fax machine in healthcare, instead of what we would see as being more the opportunity to dissolve the problem is this conversation about what should the system look like? How do we enable the interoperability so that we don't even need a fax machine, because the information can, the system is designed so that the information can flow to the places it's needed. And it's also just part of that whole conversation about the stress that we see in the system, and trying to create the conditions that supports the care that we want to see and supports the workforce and the patient's care team that we want to see. If they don't have the information at their fingertips, we're not creating those conditions. If we only sort of look for the low-hanging fruit, I don't think we're actually going to change the conditions that the workforce and patients and families are in when they're seeking care in healthcare.
AMedico is the Alberta Medical Device Innovation Consortium, a pan-Alberta network of researchers, industry partners, and community members working to address the need for tailored healthcare technology solutions and interventions poised to reorganize, reinvigorate, and redefine Alberta's medical device sector. Health Everywhere Hub is Alberta's digital health hub, uniting programs, experts, and resources to accelerate the commercialization and scale of e-health and m-health technologies. Both initiatives are supported through the Major Innovation Fund, led by the Alberta Ministry of Technology and Innovation, which enables strategic investments to strengthen Alberta's innovation ecosystem. So, like you're saying, it's not just the technology. Maybe if you could change one policy or one organizational practice, one mindset tomorrow, what would those changes be to help, maybe apply some of the framework that you have put forward here, or to help make some improvements, not for the low-hanging fruit piece, but to work away at that systemic issues that you alluded to?
If I could change one thing, and the risk is that I'll take yours, Teri, it is we feel like as a society that we have a duty to protect health information. And I feel that too. I am not in any way advocating no privacy. I'm saying privacy and I think that the one thing that I would suggest is that we need to switch from a duty to protect to a duty to share in our health information legislation. Right now, our health information legislation largely reads as health information privacy legislation. And that is important. But I really believe that we need to have and shift the culture such that there's a responsibility for organizations, individuals inside the health system to be sure that the information is being used and that ensure that the information gets to where it needs to get to. You can't just send a fax, and this is a little bit of a tongue-in-cheek comment, but like you can't just send a fax and be like, I've done my job. You need to make sure that the fax arrived. That's a slight, like, there's not much of a difference there, but a really important difference in the way that we sort of think about information, that I need to be certain that communication is being received rather than just sending it out. And I think that if we redesigned our legislation with that idea in mind, in fact, some of our colleagues that are expert in health information legislation have even given suggestions on how that would happen. But that duty to share would be an important, shift in the way that we think about health data design.
I tend to go back to the need for, and if we're talking about mindset shifts as well, the need for that real understanding of the need for teamwork in healthcare. And
Sure.
that the duty to share fits with that. Because if you don't understand how you rely on each other in order to be successful, which is the definition of teamwork that we go to, then you don't necessarily feel that duty of being able to communicate and make sure everybody's on the same page and you understand the plan and you understand what to do if something doesn't go according to plan, which is all sort of critical components of teamwork. And we quite often talk about teamwork at the micro level. How do we set it up so that the patient's care team, that teamwork mindset is the default, and we make it easy for people to work effectively as teams in teams. But we also need it at the system level. We need that collaboration. We need that that people see themselves as members of the healthcare system, that they have a role to play in the system, and that you actually understand the system as a whole. Whereas a lot people, I think, quite often will understand their role within their unit or their clinic or within a part of the system or within their profession. But that extra sort of layer on top of that of being able to understand the system as a whole. We've had interesting conversations when people are using the term system and what they mean, because there was one in particular that I remember being like, he keeps sort of referring to the system as that thing over there, like something else that they're pointing to over there, and not using it as sort of recognizing the role that they have as a member of the system and that we're all part of the system. And I think that's not uncommon. And so I think that shift with that true teamwork mindset would be the thing that we point to. And the reason for that is because we think it's safer.
Great point.
Yeah, I love how you both shaped that together. That I feel like the system word really captures it well, because I think of my own background working in like an X-ray department, for example. I think of myself as being on that team and also the hospital team. But the system really goes beyond those borders of those walls, right? And thinks about all of the interconnected pieces. And that seems to be a great way to reach people. I wonder, I don't know. That topic right there could be an entire podcast episode in itself, I'm sure. So that brings me to kind of what we had mentioned earlier about future healthcare professionals learning today about digital health, about data stewardship, and collaborative information sharing that may not currently be emphasized in their education. How can we set them up for their awareness of a system that we want to see like this, and give them an opportunity to understand and practice it?
Some of the things that I've observed, even the work that Teri and I do, so we're part of a network called Networked Health, and we have, nodes in Alberta and BC and Ontario, and it's sort of a movement that's growing across the country of people that are united behind these principles. Um, and what I have observed is the number of young people that are engaged in that work is really remarkable. That they'll volunteer their time on top of the many demands that they have, and you know, so I point to that regularly as a point of hope for myself that you know this is going to take like a long time to fix, I think, unfortunately. And um, it's not as simple as just acquiring some new technology. Wish it were, because it would be easier to fix. But culture change takes time, and it's the rising generation that's probably going to lead that for us. A few of us that are the old guard that are calling out that the need for change, I think, are important too. But it's the rising generation that's gonna make those changes. And so um, it's a half formed idea, but I think that I'm optimistic because of what I see in the work that we do. So,
And I think one of the things that could be impactful or potentially important is having the conversation about the current reality, but not taking an approach where we're teaching that this is the way it is and it's never going to change and you have to learn how to function in this current system and just teach that. I think they need to be prepared for the current system, but also have that understanding. And that's partially why the sort of principled approach that we've taken with networked health, I think, is a strong approach, because those principles, like the evolution that happens within the guardrails of a principled approach, like we're not defining exactly what everything's going to look like or a linear path for the future. We're saying that these are the things that are important and acknowledging that it's going to be kind of messy in the middle. And I think making sure that students understand the current reality, but also their role in how they can help to change the system, because I also agree it's going to take a while. But that we do need people ready and willing to participate in the change that we want to see in the future. And it's one of the things too that I hope, because there has been times where we've been a bit concerned about being too pessimistic and potentially having people decide, do I really want to work in that system? It looks like a mess. It's going to take forever for things to change. And then is there something else that's more interesting? And I think we do need to be creating the opportunities where students can feel like and early career can feel like they're making a difference and that there's a light at the end of the tunnel, so that it's not that we do a really good job of training them, drop them into a system that's a bit dysfunctional, and then have them be like, no, I'm out. This doesn't feel safe, or this doesn't feel rewarding, or what I thought it was going to be. So I'm going to take a different path. We need those people. We need people in the healthcare system. We need people ready to participate and contribute to the future healthcare system that we want to see.
don't you think, Teri? I mean, this is a societal progress we need to make. Like this, like our whole nation needs to change this, and in fact, the whole world in many ways needs to make these changes. And there have been there's other things that are changing in society that give me hope that the rising generation is just going to demand better. And I think the way that we educate them for that future is showing them that better is possible. Helping them realize that like it doesn't have to be this way.
Yeah.
And as soon as they realize that um, they'll be the groundswell, because that's what it's going to require is society saying this isn't acceptable anymore. And I think we can get there with the help of the rising generation.
And it sounds like you both are modeling the way through organizations, like you said, this Network Health, where you're connecting across the country, which is fantastic to hear. There's a lot of opportunities to learn from others and share your learnings. So I'm sure that's a huge piece of mentorship that you both do, I know. Assuming that we have captured our healthcare leaders, our educators, our frontline practitioners listening to this podcast here today, what is something that you would action for them to immediately take on to advance a more connected, person-centered health system?
Well, the one piece that is happening right now is Bill S5. So there's federal legislation that was tabled originally in the Senate, is now into the House. I mean, the House of Commons is taking a summer break, so it'll get picked up again, hopefully, in the fall, but showing support for that as a piece of the puzzle. It's not, again, like the purchasing technology or one piece of legislation isn't going to solve all of it, but I do believe it is a critical piece. And just even participating in that conversation to support it or ask questions or be informed, I think that can be really important. It's an opportunity to learn more about how the legislation can make a difference and what the legislation is. Right now, the Canadian Medical Association is doing their website that I can share the link after. It's their health advocacy website, has a letter writing campaign. It's very easy. It takes 30 seconds to send letters to the health minister and your local MP to support that bill. So that would be one piece that I would get people to check out and support or learn more about, at least.
Yeah, I would say the same thing. That's exactly what I was thinking is, support Bill S5, which is a wonderful piece of legislation. It's just the start though. Like, it doesn't do it all. So, there's, the federal organizations have done a good job of saying this is a signal, and now the provinces are going to need to pick it up and see how they decide they're going to, assuming that it passes and all of those kinds of things, see how they're going to adjust or adapt according to that. I think there's some interesting work, but that's the place that I would start is supporting Bill S5 and then carefully following through when it starts to come out in regulations and all of those kinds of next steps that come from new legislation.
Great recommendations. Get involved. I fully support that. Throughout your work, you've both approached this issue from your own lenses, your perspectives, research and patient advocacy. What have you learned from each other, and why is it important that you both why is it important that both voices are present when designing the future of healthcare?
I will gladly sing the praises of Teri and Dave for my entire career. I have learned personally so much. I started this down this journey coming from the perspective. So I'm a scientist. I use health system information to study the health system and make recommendations on like this could be better, or this could be better, and this could be better. And got to know Teri. How long has it been, Teri? Anyway, it doesn't matter. A number of years ago, and got to know her and her family and Greg's story. And I can tell you that my personal view of health information and the need for sharing and even just like what we need to do to get to a solution has forever been changed because I know Teri and Dave Price. And it also makes it, as I've got to know the Price family and appreciate who they are, all of those kinds of things, it's also incredibly motivating when I see I didn't know Greg, but I feel like because of how much I care for the Price family, I feel that in my desire to make things better. And it's changed the way that I do every piece of my work. And um, so the point that I'm getting to is that they've changed my perspective. The so-called expert in the ivory tower, and so I'm very grateful for that. And I think that the value that the academic community can bring is, taking these real problems and the perspective that Teri brings and her dad Dave and all of their view of how we get to a better solution, and then bringing some grants and scientific work around, let's study this together. And it's a great 1-2 punch to trying to solve this. Would you like to go next, Teri, my friend?
Yeah, it's hard to follow. But I think, and honestly, I would reinforce that being able to learn, like likewise, like for us to be able to learn and know that there's partners like Tyler that we can lean on and learn from and have aligned objectives that we can depend on. Like it's so, I completely trust him and have no problem reaching out when we need something. And I think that Tyler in particular, but networked health in general, having the diversity of different perspectives all involved working towards some aligned goals, following those principles, like that approach is something I really hoped would be effective and possible. And it's just like, in order for us to learn beyond our unique perspective, we wouldn't be able to learn effectively about the healthcare system and have continue to refine what we think is important, or to really get that deeper understanding of the system if we weren't able to interact with people with different knowledge and experience and the expertise, and especially in the academic world, because it's not my background or my dad's background at all. And so it's through partnerships and meeting people like Tyler that has really enabled all of this, and keeps us motivated and wanting to continue doing the work that we're doing, because we don't feel like we're alone in this. We know that there's lots of people with similar stories or stories that they see when we share the film. It's very common for people to share their own experiences, whether it's from a patient family perspective or workforce perspective. And that we want to be able to understand that experience and be able to spark the kind of change that we need to see in the system. And we would not be able to do that if we weren't able to partner with like Tyler and his team and the university and other groups that are all collaborating that also want to see a better future in the healthcare system.
Teri, can I maybe even, like, as I'm thinking about our own experience, like you and I, and how long we've known each other and how we've worked together, and I remember having a conversation standing in my offices with you and your dad, and talking about, after showing the film to to the people that I work with, the people in my center, and talking about solutions and all of that kind of stuff. And if I think of that day and my clarity of thought on what, like, I thought I knew how to solve this problem back then. and where we are today, and the evolution of our thinking, like collectively, you and I and Ewan and Stephen and all the people that have been foundational to networked health through the years. um, you know, I really truly believe, Lisa, that we now understand what the problem is. I thought I understood the problem a few years ago. I started a company as part of my work with Health Everywhere because I thought it was a technical problem. I'm like, we just need to plumb all these things together, and then we'll have everything fixed. Um, and that's not the problem. It's a part of the solution, but it's not the problem. And so, bringing the perspective of people from the health workforce, people from academia, people from industry, patients, like you bring everybody together, and they're like, well, this is what I think the problem is. And as you start to like bring those people together regularly, you get to a point where there's been enough bouncing of the idea around that eventually it starts to become clear. And you know in my little in my little academic world, I like I said, I truly believe that I understood the problem, but I didn't until I collaborated with Teri and with others. um, and so it's just a perfect example of, you need the diversity of opinions, the diversity of perspective, the diversity of experience to be able to get to a clear understanding of the problem.
Well, we're so grateful that you do collaborate and work together with others. You're doing fantastic work, and can't wait to see the continued outputs that come along with those collaborations. So thank you both so much for joining us today on the podcast and sharing your experiences, your knowledge around this topic. It's been a pleasure having you both.
Thanks very much for having us.
Yeah, thanks for the opportunity. Anytime. Always happy to have another conversation like this.
This health innovation themed episode of Advancing Healthcare Through Simulation is brought to you by A-Medico and Health Everywhere Hub.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.